Our team, welcome back to Plastic Surgery Untold, the greatest podcast in the world, as voted by us. We're continuing our cellulite talk, doing a little luxury legs, if you will. We still have the fabulous Sarahs and our special guest, Caro, who flew all the way in for us, so we appreciate you.
Thanks for having me.
Let's go around the room a little bit, catch up with what's going on with everybody's life, and then we'll jump into a little bit of what luxury legs really means in terms of this total body transformation here. So, Sarah's?
Yeah, I can go first. I know we mentioned in the last episode, Sarah and I are back in school. We're getting our nurse practitioner, which is super exciting. But y'all be thinking about us because we are starting advanced pathophysiology tomorrow. So
please, prayers are accepted.
Yeah. We will be
phone a friend.
Yeah. We'll be spending all of our free time studying.
That's right.
But that's so that we can be better providers to take care of all of you.
Absolutely. I love it. I'm excited. And
we have better, you say.
We have 4 fabulous surgeons we're going to be calling.
That's right.
At 1 a.m. crying.
Can you please explain this to me? So, yeah.
Caro, catch me up, because you and I have talked about this idea of this entire like lower extremity, and I think you say all the time, the lower extremity, the lower body is the new face in terms of just this overall rejuvenation of the legs, but as a entire subunit and not just treating a cellulite dimple stuff. Talk to us a little bit about this, because you're super passionate about it.
Yeah, I'm very passionate about it because, like all of you, I've had the good fortune of being in the medical aesthetics field for a long time. So since the early days of Botox cosmetic. And so if you dated back to the year 2000 when Botox first came out, right, it was all about facial rejuvenation. And I think that now medical aesthetics has become more normalized, and we really kind of make it part of kind of our well-being and self-care regimens and so on. We're all living better, longer lives now, right? We take better care of ourselves. We take our vitamins. We go to the gym. And so it's only normal that kind of we do a scan of the whole body and think about what are the areas that are just not fitting well with how we feel. And so the lower body, I think, is a big part of that. So, and unfortunately, it's also the area where it's been a bit of a mystery kind of what happens in the lower body, right? Because oftentimes when you ask a woman, and I have this conversation with my girlfriends all the time, tell me what you don't like, in the lower body. And it's hard to describe because many women feel it's like it's everything, and, it's because we work out so hard. We do our squats and our lunges, and it's just the area that is just very hard to kind of, make as look as good as you want it to. And I think that has to do with the fact that we all, I talk about it in terms of like we have the trifecta, which is you've got a bit of extra fat generally that's hard to kind of exercise away. Then you have cellulite, right? These pesky dimples that start to appear. And then we also have just the quality of our skin. And so that's sort of why a lot of women are very frustrated about it. And I feel so passionate because the company that I have the privilege of running has come up with a really great cellulite technology, and we are extremely proud and passionate about it because I think it actually does the job of treating cellulite very well. But it is only one piece of the problem. We don't solve for the skin quality or the laxity, and we don't solve for the extra fat. And so I think that kind of is opening up the whole world of what should lower body rejuvenation look like. And that's why I think patients coming to you all are just so blessed because you have such a toolbox and it's such a big focus for your practice, and you're so deeply kind of looking at these issues that I think it's going to open up new solutions.
And I think it's some of the issues and concerns and stuff is, one, this is a challenging place to treat. And I think, a lot of patients are hesitant, just like when we're talking about cellulite, is that there's been a lot of, and you said it, lotions and potions that just really never have panned out. So people are skeptical. People, are hesitant to invest a lot of time and effort into this because they don't want to be disappointed again. They don't want to get their hopes up and be down. And the other part of this is there's so many factors. So, cellulite gets a lot of the hype and the thoughts and those type of things. But, it's not the only issue. Most of us that aren't, 18, 19, 20, we got our first good sunburns of the summer and then continue to, just kind of go on life. And we now realize how bad that was for our skin. There's skin laxity, which, we have some very limited control over. A lot of it has to do with genetics and life and those type of things. And then, so there's so many factors that play into this. And in the past, there just weren't a lot of great treatments. And I think one of the big turns has been some of the technology that has come aboard recently that has really made a big difference for that. And so I think that's where this is it's really nice to be on the frontier and working with companies like yours to be able to treat this whole holistic approach. And that's where we came up with this living your luxury legs lifestyle, because that is a big change in terms of people being able to, wear what they want to do, live their lifestyle the way they want to, and address some of these concerns that they feel like just really limit what they want to do, what they want to wear. So maybe we can kind of dive into how we evaluate this, what we look at, and maybe one of the Sarahs can kind of take us through that evaluation, and then we can go through how we treat each one of these. Because I think that's one of the concepts we're trying to change. I feel like, unfortunately, a lot of practices, just because of, if you're not passionate about this concept, one, it's a super high investment, because a lot of these different devices, treatments are lasers, skin tightening devices, stuff that can be very costly. And so a lot of practices, medical aesthetic businesses only have one or two. And if you go, that's what you're going to get. And this way you can really take a holistic approach, evaluate their needs, figure out a concept, because there are some timing, some treatments that are better done at the beginning and vice versa like that. And so that you start from the beginning, get a roadmap to your aesthetic goals, and then kind of keep marching along.
Yeah, I feel like that's what I was going to say. Even in the last year, what has become available has changed a lot. And now, for our patients at Austin Plastic Surgeon, Sarah and I are super lucky to be able to say, okay, first of all, let's do an assessment. Let's stand in front of the mirror together, point out, literally show me what bothers you, because then I can tell you if it's something, or any of us can tell you if it's something that we can help or not, and then we tell them all the time, give us a year, I wish I could fix all of this in one appointment. Yeah. But if you really want to, like Dr. Franco has kind of coined this term, have your luxury legs and get, to the goal that we're all hoping for, we'll give you an outline. Like I can tell you, this is cellulite, this is skin laxity. If you want a little more volume, maybe we'll have you talk to Dr. Franco about fat transfer. If you are not interested in surgery, then we can even talk about doing some filler and stuff like that. But typically, just one of these treatments is not going to get you to where you want to be. So we'll outline a whole treatment plan for you for the next year or so to really get you to where you want to be. So you're stuck with us for a little bit, but we also are, super lucky to be able to offer lots of options for you. Yeah.
And we, even in our own practice, have recently hired a coordinator that's going to help do your cellulite coordination, in terms of this, because I think just like, for surgeries, mommy makeovers, these transformations, you have someone that's helping you through this process because it can be super complex. There can be a lot of appointments, those type of things. It's nice to have a point person that can help make sure that everything is organized for you and so forth. And so that's a big change in our practice, because we understand the complexity, the time, the effort. And so that you have someone that's going to make sure that, they help guide you through all this, because I know the areas are super busy. I text them all the time, and then I may or may not get a response, but they would probably because they're responding to all of you guys. So
and they also can go over financing options, because you talked about how it can get kind of pricey. So we're excited to be able to not only lay out your appointments nice and organized, but also go over options to finance that for you.
For sure. We want to talk a little bit about the options that we do have.
Yeah, and do you mind if we talk about them in order? So, because one of the big ones, and I think one that very frequently people mistake for cellulite is skin laxity. So maybe let's start at skin laxity, what we can do for that, and then kind of keep marking down, and then we'll do cellulite, and then do some depressions, which not all depressions are caused by cellulite, which is sometimes I think confuses people and gets misnamed. And then we can jump into some of the surgical treatments, because there are just sometimes laxity, volume deficients that need more than we can do with non-invasive or minimally invasive treatments.
Yeah. So as far as laxity goes, one of the newest devices that we have at Austin Plastic Surgeon is Morpheus 8, which we've really been loving. We have the face handpiece as well as the body, and recently went to a really big conference with them and learned a bunch of new awesome settings and tips for our patients in regards to that. which is just good old-fashioned RF microneedling on steroids through Morpheus. It can treat at several different settings and depths in the body. So it actually goes all the way down to 7 millimeters, which they coin as a surgical depth. To get the ultimate skin tightening. They also offer a handpiece on the Morpheus 8, which I think is awesome and something we hadn't brought up yet, which is just textural changes to the skin. So we can actually resurface the fine lines and wrinkles as well.
Yeah, with the resurfacing tips. So if we need to tighten tighten loose skin, we go a little bit deeper, even can do a little bit of fat remodeling. And then like Sarah said, we can actually use a separate tip called our resurfacing tip, only a 0.5 millimeter depth to really target the outer layer of the skin and give you that smooth appearance.
And the reason I like starting with skin laxity is that even if you release dimples, even if you restore, if you're trying to just do volume, and we talk about this in the face, if somebody needs a facelift or needs some type of tightening, they need it because you can do a ton to the underlying structures. But if you try to overly fill people or you release these bands that are causing cellulite, but you got a lot of skin laxity, then you're not going to see the benefit of it because you've released that. But part of, the reason that, people look good, with a cellulite, release of these bands is because that skin pops back like a trampoline back into place. If there's no trampoline effect, that skin's still just gonna kind of hang there. And no question, we don't want to overly promise. If you've got, if you've lost 150 pounds and you got a lot of saggy skin stuff, Morpheus, RF microneedling probably is not going to be your option. There's other options in terms of surgery and skin tightening like Renuvion Body Tight that do some skin tightening under the skin so we can be a little bit more aggressive. And then the next step up is doing some type of body lift, circumferential lift, surgical butt lift, if you will, where we actually remove some skin, do some reshaping in terms of that. And that's why we really want to guide you through the whole process because depending on where we're at, we don't want you to spend a ton of money on fillers or other things if we know that you need a surgical treatment in terms of this. And then we can kind of get you to a good spot. So it's not, you don't wait till after you've paid a lot of money for treatments and decide, oh, well, you really needed a surgery or you needed X, Y, and Z.
Yeah.
Yeah, I think assessing the patients, when we do talk about skin laxity, how much do they truly have? Is it something that we can treat with dilute radius or Sculptra and give them, 30, 50 cc's of volume that's going to help kind of airbrush and soften the laxity that we see, or do they have to go like full on fat transfer?
And I like what you said about starting with the skin laxity because, we're kind of creating a bit of a controlled injury, which as it heals helps with collagen stimulation. The skin itself is going to be more, have more elastin, more collagen. So then when we go back and treat the cellulite, we have a much better chance of that skin bouncing back, like you said.
And this is where we'll guide you because I love Renuvion, Body Tight, these radio frequency energies that can go under the skin, so they're a little bit more aggressive than like a Morpheus would be. Body Tight is the equivalent of that again goes under the skin and applies that energy, but still to a point, and it's one of the areas of technology that I think is only going to continue to improve over the next few years and make these treatments even better as we kind of develop new settings, modes, and stuff for some of these energies. Remember, it's always the fine balance between tightening skin without causing any true injuries to the skin where you're going to have some permanent effects. It's a controlled injury, if you will. If we keep any other comments about skin laxity is a tough one and we could spend a whole episode on this, but just want people to understand it's one part of the evaluation process. There's different treatments depending on how aggressive or not we need to or want to be.
Yeah. I think just what's so exciting is just the education alone that women can get, right, from these kind of conversations. Because for so long, women wonder, what's all going on there? I don't like any of it, but they can't really explain it. And so it's so exciting that now they can go into a consult with you all and you can just kind of like dissect it properly, right? And I don't think that we should be afraid of this whole kind of treatment plan because essentially, that's what happened, with the phase 2, right? We started with Botox, and then it went on to dermal fillers, and then, we also know that you have to take care of the skin itself, so skincare products became much more important, and now we're talking about skin resurfacing, and so energy-based devices. And I think that, the education will start to click, I think, similar to the way it's happened kind of in the face. And so this is very exciting. I think for women to finally know it's not your fault, whatever you're doing, these are kind of issues that all women have. It's not just you, that the majority of us have these kind of little complex kind of areas. And now there are really specialized practices like you all that are really coming up with a treatment plan that even over, a course of time is really going to really meaningfully, make it better. So.
And then as we kind of keep moving down, so, once people are in a good spot and we have good control of the skin laxity, or if we're doing it in conjunction, then treating actual cellulite, because that still is a thing for sure that can cause people in the buttock and thighs. And so, we have a couple different treatments we offer depending on people's specific needs. I think the two biggest ones on the market right now are Avali, obviously, and then Quo, which was the first FDA approved injectable. And I think even in our own practice, we've really kind of honed in who we like to treat with what and kind of how we go through that program. Do you guys want to talk a little bit about cellulite management for people as part of this holistic approach?
For sure, yeah. And if you missed our last episode, we dove into detail about what cellulite is. But remember, just treating skin laxity isn't going to fix these dimples, because they're really caused by those like web of fibrous bands, essentially, not just one band, which Caro was pointed out so eloquently for us. But we have some patients that maybe if they have just a few dimples, they prefer an injectable over a minimally invasive treatment. We could treat them with Quo, knowing they'll have to come back a few times. We also have those patients that have deeper depressions, quite a few of them, really need a quick treatment. Maybe they're in from out of town. Avali is definitely the better option for some of those, because, we can do a one and done treatment, and we're able to treat, would you agree, a little bit more at once?
I agree. Yeah.
I for sure. I think when people have the deeper band stuff, I think for us who have a lot of people from out of town, it's hard to do multiple treatment stuff. So I think that's super, super helpful. It's, I think, nice and kind of reassuring when people have some of these really deep bands that you make sure you release some of those, because I think that can be super challenging in terms of this. I think it's also nice in a lot of our patients who are coming in for butt augmentation stuff that that you can treat this pretty effectively ahead of time. Sometimes, if people are, and not that any of us are procrastinators, but if we're waiting until right before a surgical treatment to try and do some of this, that can be super, super challenging for people. And it's nice to be able to do one and done. I think sometimes too, just in the busy life that we all live now, we were just talking about your travels and everything else that Caro does around the world. Sometimes your opportunity to do a treatment, do something, maybe a very limited window. And so the more that you can do, obviously safely in one setting and one time, I think can be super attractive to people.
Yeah. I that's exactly also one of the, when you are on this side of the table where you're thinking about what products, when you raise kind of areas of concern and say it's really kind of an unsolved area, there are many companies that will really dig deep into those problems and try to figure out solutions. I think you just raised a very good point, which is we do have to accept that while medical aesthetics is becoming really a normal consideration as part of self-care, we do live busier lives than ever. And I think that, whatever you do, it has to be practical. So, that was one of sort of the big standards that we wanted to meet with our product Avali for cellulite. We wanted to really set a new standard and treat it very effectively. So it would be worth paying for, it would be reproducible for you, something super reliable. But we also wanted it to be easily incorporated into a busy woman's life. And so that's why a one-time treatment that would allow you to really verify your work and make sure that the dimple, that tension on the skin would truly be resolved in a one-time treatment was really important to us. And I think that we've done that well.
And it's been interesting for us, even from a surgery procedure standpoint, because during the COVID time when people were working from home and doing some of those, people had a lot more flexibility in their schedule. I'll tell you, we've already seen a lot of people who all of a sudden their job may be like, hey, you're working at home, and on short notice have been like, hey, you have to come back into the office by this date. And it has changed how we've seen this. And I think some of it we had forgotten before so many people were working home remotely, different areas. So I think definitely time is, and being efficient with that time is the thing again.
But the other thing that I love about sort of, awesome plastic surgeon is like, I think that we all have to embrace, and I think you're seeing that sort of acceptance more and more so. At one point as women, we are all becoming very educated in the field of medical aesthetics, right? We like to do our homework. A lot of people dial into this podcast just to understand and learn. And every area of the body, at some point, there's a whole spectrum of treatments you can consider. But similar to, for example, with the face, at one point, whether it's age-related or the acceleration of your aging process, which is very personal to each individual, you might come to the conclusion that, you don't want to keep doing all these fillers, or you have to, essentially go in for your filler treatment too often now because your face maybe ages a little bit more. And then maybe a mini lift or a mini facelift is a better option for you. And I think that's sort of something that we see more and more also, that women are starting to understand it's a whole spectrum. Mm-hmm. And surgery was a really scary thing, 20 years ago, with lots of downtime and sort of lots of scarring potential and incisions, but that's not the case anymore. So techniques in surgery have become so progressive that I think the downtime and the recovery are just really much more easily manageable,
And then can we keep moving in, because there's the true cellulite dimples, but then there's also, and I call them, depressions or contour deformities. And so, I think sometimes too people are confused that it's a true cellulite, but sometimes there's other things that cause depressions, and it can be volume loss, even, intramuscular injections that didn't get in, steroid shots, other things, trauma. Sometimes we follow it, and you lose some fat over time stuff and get some depression things. So there are some other things that cause the butt not to have the shape that we want. That's not just true cellulite. And that's part of, during the evaluation and why we ask you a bunch of questions, especially if something looks a little bit off, because we're trying to get to the actual source of this. And it's funny, I was on a panel once talking about cellulite, and a very prominent dermatologist was telling me she had a friend that she had treated with everything under the sun for cellulite, and they were talking at one point. She's like, yeah, it's just frustrating how this hasn't gotten better with all these cellulite treatment stuff. And the friend she's talked to her a million times about it, goes, oh, well, I've had this since I fell. And she's like, wait, what? And it was interesting because this is someone that she had a great relationship with, had talked about this, and for some reason just had never brought up that the depression, came after a trauma, which we would all treat very differently. And so, bear with us when we're asking you 1,000 questions, because we're trying to figure out what's actually going on, especially if something looks a little atypical to us. We're probably going to ask you even a few more questions, because it really does alter how we treat you. And then we can get into some of these. I also tell people, look, if you've had cellulite for, 30, 40 years and you got some depressions, the idea that we can just cut this band and that your skin's just going to magically pop up and be perfectly baby bottom smooth at that point doesn't seem super realistic to me. And so this is where a lot of times we can release these bands and then come back and do some smoothing techniques in terms of doing some fill, because like the Sarah's mentioned, some of the off-the-shelf fillers are fabulous, but there's a limit to how much you can do for most of us in a practicality standpoint from a sheer cost volume type thing. But when you're treating a few residual spots, definitely becomes much more worthwhile. I also think if you're trying to, and this is why we try to walk you through the order, if you're trying to treat some of these cellulite spots with just filler and you haven't released the cause, one, I think it's always going to be a limit to how much you can pop these up, because you're always fighting a battle type here. I think you're also not going to get as much out of the product as you think. And so I think just trying to stepwise this.
Yeah. We did a couple combo patients recently that I can think of that we did ovally first and then waited about 4 to 6 weeks, brought them back, and then did what we call a tweak treatment with Radiesse to just kind of smooth everything out. And the results have been really, really nice so far.
Yeah, for sure. And like you said, just going back and doing some perfecting. So we're not adding like BBL type volume.
Right.
We're just perfecting any of those stubborn dimples that were left. And also, if we're using something like Radiesse, we're getting a little bit of collagen stimulation as well, which is just going to help smooth, add a touch of volume, but not a lot, and kind of the icing on the cake.
What are some other fillers that you guys do? We talked on dilute Radiesse. Is there other stuff you guys like to use in the legs, buttock to help with some volume replacement?
Yeah, Sculptra is another one that we love. Again, like you said, cost can get a little pricey if we're talking large volume, but for small volume, Sculptra is great to stimulate collagen as well. It's something that we pre-mix in office and have you prepay for, and then come in. And, the appointments for this type of stuff is usually only just about an hour or two, like ovally. So it's nothing that's long and drawn out. It's something that we can really specifically target areas that are bothering you and treat effectively.
And something on Sculptra that's important to point out is you're going to have some immediate volume from the saline and everything, but then that volume is going to initially go away until that collagen formation builds back up, right? So we try to be super realistic so you're not like, wait, what happened? It's gone. It'll come back.
Yeah,
give it some
gotta
time.
give this stuff some time.
But something for you to know for sure.
And then other things to just think about is, we were talking before we started on air here, is that, there's some people that just need a more aggressive, more treatment in terms of surgery. If you have a ton of volume that we're trying to replace in terms of shaping, then we look at a Brazilian butt lift, fat transfer, possibly butt implants. We also even talked about if you're looking at the legs and a lot of skin laxity, then we can even talk about a thigh lift and those type of things. Because if you're someone who's lost 150 pounds and you have a lot of skin laxity, none of these treatments are going to get you to where you want to be. And then I'm not saying that we may not come back and treat some cellulite spots, do a little bit of fine icing on the cake, but we really got to get you to a good spot where those treatments are going to make a difference for you. And that's where making sure that we're making steps in the appropriate manner, because if we do a thigh lift and we get rid of that majority of the skin and then you just got a little bit around the knees, maybe a little bit, right on the outer hip stuff that we want to tweak, then that becomes a reasonable thing to manage. If you're trying to tighten an entire leg after 150 pound weight loss, that's going to be super challenging and probably set you up for, disappointment if we're not doing the appropriately aggressive treatment to begin with.
Yeah, for sure. Just talk to your provider and we can kind of point you in the right direction and set realistic expectations.
Can we go ahead?
Something else I wanted to mention that you just made me think of, you had a patient that had fallen and had a kind of indentation to their buttocks. You remember who I'm talking about? We went in with Radiesse, but we also found that part of the issue is that because of where the divot was, we noticed there was a larger bulge of fat above that divot. And so that's where we can bring in Eon, which is our touchless fat reduction laser, to kind of just shave down that area. And, through doing consults with you, that's not necessarily a spot that you'd want to go in and lipo. So it's nice to have those little treatments as well that we can kind of help contour the butt without doing surgery.
Yeah.
And contouring the butt and legs is a concept that's only going to continue to evolve. I don't think that the fascination with butt and legs is going to go away. I think the idea that you just want this massive out of control butt is probably going to be for select few individual stuff. But I think the idea to have a nice perky shape, to your butt and legs, that is not going away, especially now with fashion trends. Can we jump into a little bit of specific combination treatments? Because we've kind of talked about all the different things. One of the interesting ideas, and we've started a new package called the Boom Boom Booty, which is a pre-treatment for cellulite and then the fat transfer. And this stemmed from a study we had done with a cellulite treatment. And we're actually presenting it at this year's American Society of Plastic Surgeons, where we pre-treated people for cellulite and then did a BBL. It was interesting because the satisfaction rate in those patients is over 90%. I mean, anyone who's looked at Amazon reviews, over 90% is high, to keep everybody happy. And so, and I think it really just goes to the idea that Caro was talking earlier about this holistic approach and people really, really wanting, a better overall shape. It just shows you that, the satisfaction rate is higher in these combination treatments rather than each one of these alone, and not just by a little, by a lot, which is super impressive and super exciting. Probably why we were invited to talk at this international meeting.
Super exciting. I'm excited for you. I can't wait to hear about it.
Hold back your excitement.
I'm so excited.
And Sarah helped do the study, so she's not really surprised. She already knows. And then some of the other stuff in terms of packages that we're trying to work on, because I do think there's so many people, you see these round 2 BBLs. We're also working on some tucks called, BBL retouches, because I think there's a lot of things that you could go. I see a day where we have these luxury legs packages where we do, some pre-treatments for cellulite. We do our fat transfer, and then as part of that package we also have some of the Morpheus or Vivace to help with some of the fine texturing skin. Just like you look at a facelift, right? The idea that you're going to pull a face so tight that you're not going to have any fine lines and wrinkles just doesn't make sense. Nobody gets out of their convertible and goes, I was going 100 miles an hour, my skin looked fabulous, So the idea that you need to do some volume, you need to do some fine line skin tightening, that's true for the buttock and legs as well. And so the idea would be they would be pre-treated for their cellulite. They would do their liposculpting, their fat transfer, and all the things that we do with the fat transfer in terms of like the lipo on the bottom of the butt, the little sweetheart, the Victoria's Secret to shape it. And then once that heals, we'll do some final touching skin resurfacing with the Morpheus. And then the final touch would be doing like a tweak treatment or a little bit of filler to kind of fill out some of these icing on the cake spots, because, it's really a lot of steps, and it's amazing how, this whole journey can really come together. And it's some of the stuff we're trying to work with people and get a better package for this. And I think that's exciting because that's going to be the next frontier.
I totally agree with that. And I think that, look, we as women, most of us are not the most patient, right? But I think you all have studied this now so much, and you've tried many different combinations. And I think your before and afters are really starting to document kind of what that improvement can look like if you are patient and if you just follow good guidance. And if you go to experts like you guys that can really kind of dissect all the little areas. And I think that should make a lot of women very excited.
People always ask about recovery. We've touched on it a little bit, but for people who didn't listen to our other episodes, shame on them. Number one, but two, do you want to give them a quick little background, like recovery for Avali treatment, for Morpheus, for like a tweak treatment, just so they have a good idea? I'll tell you, recovery for a BBL, fat transfer buttock. I typically tell people, most people will be back to work in about a week and a half or so. Can't sit on your butt for about 6 weeks. Really got to plan, about a good 2 months till you're really feeling like you're yourself. You're still gonna have a little bruising, swelling, all that shape to take place. So a little bit of a surgical recovery to Cliff Notes. What about for you guys?
Yeah. So for Avali, and like you said, we've kind of gone into detail in some previous episodes, but just to sum it all up, it's a minimally invasive procedure. You will leak some of that numbing fluid that we talked about for the first couple hours after the procedure, but we'll send you home with some pads, some compression shorts. You can head back to work the next day. We have you avoid working out or anything that's going to get your heart rate up high for the next couple of days. Send you home with some arnica, but the bruising is minimal compared to some other treatments. So really minimally invasive. Downtime, we're talking a couple days. Still, we have you do it about 4 weeks or so before any sort of fashion show if you're going to be in a bikini or anything like that. But really pretty quick turnaround.
Yeah.
You want to touch on Morpheus recovery?
So Morpheus recovery, we do the treatment in office. Again, takes about an hour or so. You're a little red and pink when you leave. Typically, we've noticed within about 48 hours that redness is subsiding. And then we obviously ask you to stay out of the sun for about 2 weeks. That's the biggest part of any kind of Morpheus and laser and treatments and stuff like that. But overall, not very minimal downtime. People can take Tylenol if there's any discomfort afterwards. You and I actually just had it ourselves on our face a couple weeks ago. And I was surprised at the downtime. By the next day, we pretty much looked like we didn't have anything done.
Some dryness, and that's same on the body. And that's one thing I want to make sure we touch on is even if we're doing all of these treatments, we still want you to take care of the skin. So we'll recommend some products for you, one, while you're healing, and two, just long-term to keep it moisturized, help with cell turnover, help with collagen production, all of that. But we want to protect the investment, right? So make sure you're taking care of your skin product.
Yeah, Revision Body Firm is one of the products that we have that's really great just to help kind of a little bit of that textural issue and laxity, just to maintain what you already did.
Yeah.
Because I think people forget, sometimes we can do all these great things, but if you don't maintain and take care of this, you can really backtrack. And so, still got to be good about sun exposure, still got to be SPF stuff. I think yo-yo dieting, stretches and skin, so forth like that, especially if you're treating skin laxity. And I'm not casting any stones. I'm the worst about yo-yo dieting. But as the older we get, the less our skin bounces back from some of these things. So really, really don't want to test and see how much your skin's going to bounce back after weight loss. So the more you can maintain, the longer results are going to last, because that's a very common question. How long is this going to last? And part of it we can tell you in terms of the treatment, but part of it depends on how much you help us take care of this.
I'd say that's the number one question we get is when do I have to redo this? How long is this going to last me?
The nice thing, and I know you guys are having some more approvals coming out soon in terms of the length of the treatment for Avali. I'll tell you conceptually, once you cut those bands, they're gone. But that doesn't prevent, overall aging of the skin, doesn't prevent laxity of just normal aging, especially if we're having changes in weights and other things like this.
Hormone
changes. Also doesn't change, if you continue to get sun exposure and changing the texture and those type of things. So that's why we bring up so many of these other things that seem very, very minute. And it's funny because I once had a patient be like, they want to do some stuff for their skin. And they're like, what can I do? I was like, well, you can use a sunscreen, a moisturizer, and stop smoking. They're like, okay, I don't want to do any of those, but what else can I do? And it's like, here's like the cheapest, easiest things. And honestly, if you quit smoking, you probably paid for all the other things. But it's just funny sometimes how, we can be really, really hard on our bodies and be a little bit self-destructive in terms of making good progress.
Yeah. And on Avali, we did a year-long study. And so excitingly too, we submitted that data to the FDA, which is the governing body that really reviews all these drugs and devices and clears them okay for release in the U.S. And we just got our long-term indication. So that means that Avali actually is now approved or cleared for the long-term reduction of cellulite. So we know that it is a long-term result, which is great. Having said that, just because you treat your cellulite in one area, it doesn't mean that you'll be saved from cellulite in other areas, and I think that's an important consideration. So,
and Sarah brought up a good point about, because we do know hormones play a role, and as we age, unfortunately, hormones kind of change and play some of that. And so there are lots of factors.
Yeah.
What other kind of full luxury legs package stuff would you guys like to touch on before we let people go and let Caro catch her flight, because she was nice enough to fly in for just the day for us?
I love hearing all of this too. It's like sitting here both as obviously the head of Revel, but also as a woman. I think it's amazing.
Yeah, I think that's why we're here. Sarah and I have a background in the hospital life for 10 years, and I think being able, like you said, to provide confidence and empowerment to women and making them feel comfortable is something super awesome. And I think luxury legs is gonna help even more with that.
Yeah, I think just remembering it's a process, right? So we're going to give you lots of different options based in it's not a one size fits all. So come in and see us so we can really do that assessment to figure out what's right for you. We'll build a package for you and what makes the most sense, give you the order that you need. Like we said, give us a little bit of time to do all the treatments because we can't do them all same day for sure. But, we really want this to be a partnership, work together with you to get you to where you want to be.
Absolutely.
Yeah.
I think that's the biggest thing. It's a process, and being really upfront about what bothers you the most, where we can get you, and getting all those things put together for you, and then figure out a timeline in terms of this. Also, if you've had issues, if you've had other stuff, I think that the new technology, the new things out there is going to be a game changer, and it's only going to get better and better because there's a few other fillers, some other biostimulatory stuff on the horizon that are coming out over the next year or two on the market as well. So that's exciting.
Yeah, and I think that what's I think so revealing about this conversation is that it's so wonderful for women to hear you all talk about this and to know that you don't have to just accept it. You don't have to be so deflated and defeated, by all the lower body, concerns. And so I think that women will be very understanding that it's a process, but it's just exciting to get started somewhere. And I think, you guys as Center of Excellence in kind of lower body now, I think is really the great place to go. So.
Well, I'm super excited and thankful to have you join us, Caro. I appreciate it.
Thank you so much.
Appreciative to have the Sarahs here as always. Do you guys want to do a quote or?
I have one.
Okay, yeah, let's hear it.
Okay, so this is by Dale Carnegie, and it says, "Discouragement and failure are two of the surest stepping stones to success." And I think that's really great and applicable to what we're talking about today, because so many people are frustrated with cellulite, frustrated with changes in the lower body, and it just doesn't work. And I think by having those failures, we've now figured out what is actually working.
And we're going to work with them because Sarah has brought it up, and I know I've repeated this a couple times, but definitely a process. Definitely have to be patient, but we'll work with you to get to a good spot and make sure that you're bikini ready for next summer. So that'll be super exciting. So want to thank everyone for coming out. Super exciting. Don't forget you can listen to us anywhere you get your favorite podcasts: iTunes, iHeart, Spotify, Pandora. Or if you'd like to see our lovely faces, you can check us out on YouTube as well. We'll see you guys. Thanks for joining.
Bye, guys.
Bye.